Hi, my name is Renee Keene. I'm with United States University. I will be recording this exam and uploading it to YouTube in an unlisted manner, and it will be viewed by myself, my faculty, and my professor. Do you give your consent?
I give my consent.
Okay, great. So we're going to do a musculoskeletal examination today, and I'm going to be just doing a bunch of things, and I want you just to, when I ask you a question, just respond yes or no, or okay. So we're going to first start out with your hands. So I'm going to just be looking at your hands. I'm inspecting them for any redness, swelling, or joint deformities. I'm looking at your symmetry of your joints, and then both look good. And they both look good. And then we're going to go on to range of motion. So I want you to take your fingers and flex and extend them like this. Okay, great. And then make a fist. Okay, great. Next, I'm going to palpate the joints, the metacarpophalangeal, the proximal and distal interphalangeal joints on both hands. Any pain or tenderness? Okay, great. No findings found on palpation. Now we're going to move on to your wrist. So I'm going to be inspecting the wrist. I'm looking for, once again, color, any abnormalities in joint deformities. I'm also looking for redness or swelling, which there is none. And then we're going to go on and to do a range of motion. So I want you to flex or extend and flex your wrist. Okay, great. Now put your hands like that, and then it's ulnar and radial deviation. So go like that. Any pain or tenderness?
No.
Okay, great. Now I'm going to be palpating the wrist of the bone and the metacarpals, looking for any nodes, nodules, or masses. Nothing found. We're palpating the other wrist for any masses, nodes, or nodules, metacarpals with nothing found. Okay, so we're going to jack this up. And then we're going to go on to your, actually we're going to do two tests, the Tennell's test and the Phelan's test. These are both assessing for carpal tunnel. So the Tennell's test, I want you to first extend out, and I'm going to hyperextend your wrist, and I'm going to be tapping your median nerve. Do you have any pain? Okay. And a positive sign would indicate that she has some kind of nerve damage or nerve atrophy. And then we're going to do this one. Okay. So both the Tennell test is negative. Next, I want you to do the Phelan's test. Is put your hands like that. Okay, we're gonna. You should do it for 40 seconds, and in that 40 to 60 seconds, she would have, if she had any numbness or tingling, she would. That would be an indication of carpal tunnel, which she does not. Okay, so now we're gonna go to the elbow. So I'm assessing general inspection of the elbow. I'm looking for any redness or swelling or deformities, which there is none on this one. And then this one, I'm looking for any redness or swelling on this one, which there is not. And then we're going to go on to range of motion. So I want you to stick your hands like this, and then flex and extend. Flex and extend. Okay, any pain or tenderness? No. Okay, great. That's it for range of motion. Now I'm going to be palpating the exterior surface of the ulna and the tip of the elbow, which is the olecranon process. Do you have any pain or swelling? Okay, great. And I'm looking the right elbow. I'm palpating the tip of the elbow, the olecranon process, the exterior of the ulna, and then looking for any pain on the lateral epicondylites. Do you have any pain? Okay, great. All right, so that concludes the elbow. So next we're going to go on to the shoulders. So yes, now we take off your jacket. Okay. All right. So we're going to first we're going to go on to the shoulders. I'm doing a really. I'm doing a First, I'm doing a bilaterally, anteriorly, and posteriorly examination of your shoulders. And I'm just looking at them from all angles and looking for symmetry and any redness, swelling, or any obvious deformities, which I do not see any. So that's good. Now we're going to be doing range of motion. So just copy what I do. I'm going to be testing the range of motion of your shoulders, both of them, and then comparing them. So we're going to first start off with a flexion, okay, and then extension. Okay, now we're going to do adduction, so arms out like a cross, okay, or abduction, and then arms back to the side. Okay, now we're going to do arms across like this. Okay, great, and arms across like that. Okay, great, and then we're going to. I want you to. We're testing for external rotation, internal rotation. So take your right hand and touch the top of your opposite scapula on your left side. Okay, good. And then do that. Okay, great. Now we're going to do the internal rotation. So we're going to go take your right hand and touch the bottom of your left scapula. Okay, and then the other way. Okay. Do you have any pain or tenderness? No. Okay, great. And then I want you to, we're going to start out with, and then we're going to test right here. And then put your hands right in here. Go duck duck. Okay, so this is all assessing your range of motion of your shoulders, which there are no abnormalities seen. So the next thing we're going to do is we're doing specialty test, the Hawkins test. So this is checking for any shoulder tears this would hurt if she had something wrong with her shoulder. So we're going to start like this, and then I'm going to push. Does that hurt? Okay. Does that hurt? Okay, great. So negative Hawkins test. And then we're going to, I'm going to do a palpation of your, wait, no. So I'm going to do palpation of your shoulder. Here, put it aside. So I'm going to start at the AC joint, and I'm going to palpate for the bicep groove, the coracoid process, the subdeltoid bursa, the urnical humerus, okay, do you have any pain? No. Okay. Great. And then I would do the opposite of palpation of the right, but same thing. So that's palpation of the shoulder. So now we're going to move on to your neck. So I just want you to follow me. So first I'm going to do a general inspection of her neck. I'm looking for any obvious bone deformities, the color of the skin, any swelling or redness, which none is present. Then we're going to go on to range of motion. So just follow me, okay? I want you to put your chin to your chest, okay, and then extend your neck back. Take your chin, take it to your right shoulder. Take your chin, map your left shoulder. Okay, great. And then I want you to put each ear to your shoulder. Okay, wonderful. Any tenderness noted? Okay, and then just do a full circle. Does that hurt at all? Yeah. Okay, great. We have normal range of motion with the neck. And then we're going to, I want you to open your mouth and try to stick 3 fingers in. Okay, that's normal. And then I want you to move your jaw side to side. Okay, wonderful. And then I'm going to be testing for TMJ sensitivity. Okay. Does that hurt? Okay, great. Okay, so the next thing we're going to go on to is palpation of the supraclavicular notch. No, sternoclavicular notch. Thank you. Okay, and then I'm palpating here. Okay. The notches right here. Does that hurt at all? Okay. If she had anything broken or torn, it would usually hurt when I on palpation. Okay. And then we're gonna I want you to here stand up, and we're gonna put your back. So just well, you can use crouch down. And then I'm palpating her cervical spine, okay, her paracervical muscles, her trapezius. Does this hurt at all? And her rhomboids. Okay, great. All right, and then you can go back. This and then the test for the neck we're doing a special test is the Sperling's test. So Taylor, you're up kind of high, so it's okay. So I want you to just do this. We're going to you're gonna extend your head and then to the left. Okay, not that hard, just like a little extension. And then I'm pushing down, compressing. Does that hurt? No. Okay, now go back to me, and then extend your head and go right. Okay, great. It is normal for hers feel to have a normal compression of the cranial or the nerves in the neck, and pain would indicate a problem. So the next thing we're going to go on to is lower extremities. So here we go. She can see that. Well, here we're just gonna do. Yeah. I think that's the only way we can do it. Okay. Okay. Okay, so we're going to start out by looking at the feet and the toes. So we're going to start out with, I'm just looking at her feet and her toes. I'm looking for color, for a bone symmetry, and any swelling or redness, which is not there. I'm also looking at the arch of her foot. She has a nice arch, so she's not flat foot. And then we're going to go on to range of motion. So we're going to, I want you to flex your toes. Okay, yes, good job. And extend your toes. Okay, now take your foot, invert your foot, invert your feet together like that. There you go. And then extrovert. There you go. And that didn't hurt? Okay, great. So full range of motion in her toes and her foot. And then now we're going to palpate the interdigital neuroma. Does that hurt at all? Okay. And then proximal and distal interphalangeal and metatarsals. Okay. All right, great. Now, next thing we're going to go on to is the wrist, or the ankles. So we're going to, I'm just doing a general inspection of the ankles, and I'm looking for color, for symmetry, and for any abnormalities, which I don't see any. Then we're going to go onto range of motion, which will do active and passive. So I want you to dorsiflex that. Okay, great. Dorsiflex that, and then extend your foot back. Okay, now we're going to do passive, that was active range of motion. Now we're going to do passive. So I'm going to passively dorsiflex your foot up, passively extend your foot back, dorsiflexing, and plantar flexion back. Okay, did that hurt? Okay, great. And then now we're going to go on, I'm going to palpate the Achilles tendon. Do you have any tendon measure here? Okay, great. And then palpate for the Achilles tendon right here. No, for any masses or nodules or sensitivity. Okay, great. Now we're going to go on to your knees. Okay. So we're going to go into the knees. We're going to go do a general inspection of the knees, and I'm just looking for color, symmetry, any redness or swelling, which there's none present. Then we're going to go on to, we'll do a range of motion. Can you extend your knee? Okay, great. And then I'm going to do active and passive with that. So I'm going to extend your knee. Does that hurt? Okay, extend your knee. Okay, and then we're gonna I'm gonna passively extend your knee. Does that hurt? Okay, great. And then I'm going to be palpating the knee for the patella, the suprapatellar pouch, the sides of the patella, And then I'm going to be assessing the back of the knee, the popliteal for any kind of cyst, which is called a Baker's cyst. And then I'm going to do the same right here. I'm going to be palpating the patella, the suprapatellar pouch, the sides of the patella, and then the back of the popliteal for a Baker's cyst or knee masses, which there are none. Okay, great. So the next thing we're going to do is I'm going to have you lay down, Taylor. Here, get up, babe. And we're going to do some special tests that you can do with the knee. Right here. Yeah. No, like lengthwise. Okay. So the first thing we're going to do is the valgus and the vagus test. This is I'm going to so I'm going to start out with my hand for the valgus test on the outside, and we're going to slightly flex it. Okay, and then I'm going to abduct it from the body. Does that hurt? And then the vagus test, I'm going to adduct it to the body. Does that hurt? Okay. Then we're going to do the Blackman's test. Okay, so this is where we I'm going to be pushing on your tibia and to see if I can manipulate it. Does that hurt or for flaccidity or pain? And I would be doing this to both sides of the knees, but since this one's closer, we're going to do that. Okay. And then we're going to do the George test. This is where I sit on her foot and I do pretty much the same thing. It's just manipulating the tibia and fibula, assessing for pain or for laxity or abnormal movement of that muscle. And then now we're going to go on to your hips today. So I'm going to be assessing your hips. Yeah, okay. So we're going to assess your hips. I'm just looking for any abnormalities or any bone deformities, any asymmetry, which I do not see. So now we're going to go on to range of motion. So Tay, I want you to first, we're going to do active and passive range of motion with your hips. Okay, so first I want you to lift up your leg, extend it, or no, flex your leg up like that. Okay, and then flex this leg up. Okay, great. And now we're going to do passive range of motion. That's where I do it for you. Does that hurt? Does that hurt? Okay, great. Now flip over onto your belly. And we're going to do, I want you to extend. Yep. Does that hurt? No? And then extend this one. Okay, great. Good. Now I'm going to do it passively, which I do it for you. Does that hurt? Okay, good. Does that hurt? Okay, great. And then we're going to get onto your side facing camera. Okay? Leg straight. Now I want you to abduct your leg up. Good. Does that hurt? Now I would do the other leg at the same time, but just and compare. And then I'm going to passively abduct her leg. Okay, great. And then I would do the passively and active range of motion on the other leg, but we won't do it because this exam is long. And then I want you back on your back. And then I want you to abduct now, legs cross over. Does that hurt? Okay, and then you can do the other leg. Okay, great. And then we're going to do passively. I'm going to add, there we go. Does that hurt? Does that hurt? Okay, great. And then I'm going to do another, I'm going to push your knee into you. Does that hurt? Okay. Now, can you do it yourself? That's active. Okay, great. And then we're going to, I'm going to palpate the greater trochanter, the anterior superior iliac spine, and then here, flip over. Okay. Yeah. And then I'm going to do the sacroiliac joint, which is the dimples. Okay. All right, you can flip back over. All right, and then the next thing we're going to do are two specialty tests. One's a Thomas test. Okay, I want you to take your right knee and flex it all the way up to your abdomen. Okay, this is looking for flexion contractures. Good job. Does that hurt? Okay. And then the next one is a Faber's test. This is where I'm going to take your leg and I'm going to push back. Does it hurt? Okay, great. And this is looking for any joint disease. And I would do both sides and then compare them with those tests. Okay. And then I think the next Tay is spine. Here, yeah, you stand up. All right. Okay, so we're here looking at her spine. We're going to start off with the spine with a general inspection. And then we're I'm just looking at the curve of her spine. I'm looking at the shoulder height, the iliac crest symmetry as well, and the curve of her spine. And then I would look at the the skin between her buttocks as well, but we're not going to do that right now. Now we're going to go on to, here, scoot back a little bit. Now, I'm looking at the side for the cervical lordosis, which is not present. Now, Titi, bend forward. Okay, great. Go, try to touch your toes. So right now, I'm just looking at her range of motion. I'm also looking at the symmetry of her spine and the symmetry of the movement and a smooth curve. So I'm looking for scoliosis, which she does not have. Okay, Titi, stand up. Now, bend to the right. Bend to the left. Okay, bend backwards. Good job. And bend forward. And then do like a circle. Good job. Okay, great. And then I'm going to be palpating the spinous processes. Okay. And the intervertebral spaces of the back. And then lastly, I'm going to do percussion. Okay, does this hurt? No. Okay. Okay, great. Do you have any questions? No. Okay, Taylor, that concludes our musculoskeletal examination. Did I forget anything?
No.
I did. Hold on. I did hands, wrists, elbows, shoulder, toes, ankles, knees, hips, spine. All right.